Also yesterday, I brought you the news that 26 McDonald's workers had been refused coronavirus testing despite coming into close contact with a confirmed COVID-19 case. McDonald's identified through CCTV and rosters more than 24 employees who'd been in contact with an infected worker at their Mill Park restaurant. McDonald's told them to self-isolate for 14 days and sent them off for testing, but the Victorian Health Department refused to test them, sent them away. By the time we went to air yesterday, the Health Department had declined to comment, but they came back to us late last night, and this is just quite amazing. They confirmed that in Victoria, you can't get tested if you're asymptomatic, even if you've been in contact with a confirmed case of coronavirus. The Victorian Department of Health said asymptomatic testing is currently only recommended for people associated with an outbreak, return travellers, and close contacts of known cases on or close to day 11 following their last exposure to the case. This is what they said. Anyone who has symptoms, no matter how mild, should get tested at one of more than 100 fixed drive-through and mobile sites around Victoria. To be clear, this Victorian health advice that you shouldn't get tested if you're asymptomatic, even if you've been in contact with a confirmed COVID case, it goes against the Federal Department of Health advice, which states, and I quote, "Testing is important for anyone with symptoms and particularly if any of the following apply to you. You have been in close contact with someone diagnosed with COVID-19 in the past 14 days. Now, we all know by now, months and months into this pandemic, that you can be infected with COVID-19 and you can spread it even if you don't have symptoms. We remember when Tom Hanks got the virus and he spread it to Richard Wilkins, who spent 3 weeks in quarantine and never experienced any symptoms. This rule from the Victorian Health Department is plainly wrong and needs to change. The fact they're turning people away for testing who've been in contact with an infected person goes to show why there have been 790 cases of COVID-19 in Victoria with no identified source and 458 of them in the past 2 weeks. Joining me now to discuss this is Federal MP for Higgins, Katie Allen. Thank you and welcome to the show, Katie. Can I start by asking you your reaction to this news that Victoria has turned away, Victorian Department of Health has turned away more than 24 workers from McDonald's, even though they'd been identified through CCTV footage as being in close contact with an infected worker?
Well, Sharri, quite frankly, I am shocked. We all know what it takes to get this pandemic under control and to suppress the virus. We've been working very hard across the whole of Australia. Australians have been working very hard and following national, federal guidelines. So quite frankly, this just seems extraordinary. It's very worrying, very concerning, and I would like to hear more of why the Victorian Health Department is going it alone.
Is there anything the federal government can do to force the Victorian Department of Health to change its formal advice? I mean, how does it make sense that there's inconsistent advice across Australia?
Well, I think it's very important that we get some clarity around this, and I will be speaking to the various authorities because I think it's important that we have a consistency not only of messages for people in the community, but a consistency of messages of employees in these various departments. The federal government, through the National Cabinet, sets the guidelines, and then it's up to the service delivery of the individual states and territories to then provide the services that are required to keep all Australians safe. Now, we know that there are 3 different aspects to suppressing the coronavirus pandemic. There's a quarantining aspect, there's test and tracing, and then, of course, Australians have to do their bit with regards to physical distancing and hand hygiene. So 2 of those 3 things seem to have broken down pretty significantly here in Victoria, and it is extremely concerning and suggests that maybe the quarantine review that is going to be undertaken or is being undertaken by the National Cabinet is a very important review and perhaps shouldn't be just about quarantining, but should be about testing and tracing to make sure that we have consistency of guidelines, but also consistency of people following those guidelines. We all want to be safe.
I mean, the accountability is so important, but when people hear that there's just another review into how the states, into how Victoria has handled this outbreak, isn't that just pushing the can down the road when the problem is now, and we know they're issuing this advice now because they've confirmed it on the record?
I completely agree with you, Sharri. And when I talk about review, it's actually asking questions today. We're not expecting it to be kicked down the can like the Victorian state government is doing with regards to its judicial inquiry into quarantining, which is due to report in September, which is way down the track with regards to having any answers to what's going on. The inquiry is actually going to be started and looked into right now. We need answers right now. This isn't about pointing fingers or laying blame. It's about solving problems and working out what has gone wrong. And we're seeing in other states they are able to do the right thing, but we are letting the team down here in Victoria. So we all need to work together, follow the national guidelines to make sure that we keep everybody safe.
And we know by now, don't we, that you can have coronavirus even if you're asymptomatic. So if you have been in contact with someone who is infected, particularly if your employer orders you to get tested, but even if you're asymptomatic, you can still carry the virus and spread it.
Absolutely. And in fact, I think that's why people are a little bit surprised with regards to quarantining, that it has to be 14 days. People have said to me, why don't we just get testing and then they don't need to go to quarantining? The point is the test at the start of quarantining can help people know who are in quarantining how to keep separate from each other, which they already need to be doing. So in some ways, the entry test is not nearly as important as the exit test, but you need to have 14 days because people may have been in contact with someone who is asymptomatic, not known that they've got coronavirus, but also the test itself may not become positive for 14 days and even longer in some people. So there's a period of time which we call the pre-symptomatic period of time that lasts at least 14 days in some people, in which case there are some people who have coronavirus who are in quarantine. They actually leave quarantining with a negative test and then could become positive the next day. Now, that's not the norm. It's probably only 1 in 100 coronavirus cases, but we do know that there is a long pre-symptomatic phase, and that's why if you've been in contact with someone who does have COVID, who is a proven case, over a 14-day period beforehand, you should basically go and get tested.
Yeah, it's extraordinary that they are issuing this advice when it's been hard enough in Victoria to actually get people to go get tested, and here you have people who wanted to get testing. Look, just finally on another topic, are you concerned that there may have been any union involvement in the decision to award private contractors the job, the employment to protect the hotel quarantine rather than accept the help of defence personnel?
I am very concerned about the fact that it's been a number of weeks now that the state government has taken to accept the help of the federal government. We have stood by with an offer of support of 1,000 ADF personnel, and I'm very pleased that that support has now been accepted. But if we'd stepped in earlier, we may have had better military precision, so to speak, with regards to testing and tracing and to help this situation, which we do not want to get out of control. It's very important that we all work together, and I'm surprised that the Premier didn't take the offer of help a number of weeks ago now. It is good that he is, but it does suggest that there is something else at play, because we do know the Premier wants to do the right thing by Victorians. We do know that the Victorian Premier will want to make sure that we can get the cases down to zero as fast as we can. We're not aiming for eradication and elimination, because that's not likely to be able to occur while the COVID pandemic is raging around the world. We are going for zero, but we're not going for elimination. So clearly the Premier wants that. Why on earth does he not accept the help that clearly he has needed? And when we look at these cases of testing and tracing not going according to plan, it suggests that the help is needed, and I'm glad that he's finally accepted it, but we do need to know, why has he taken this long?
Federal MP for Higgins, Katie Allen, thank you very much for joining me this evening.
Thank you so much, Sharri.